Hey guys, Dr. Calica here. I have a topic of conversation going on with a patient right now that's really interesting, that we are both really curious to know what more people think about. So, while we're both enjoying sort of brainstorming over this particular topic, we would love to know what more of you think. If you're willing to share it in the comments, that would be lovely. But what we're talking about is the use of authority in the language coming from healthcare practitioners. So the way this would show up, of course, would be in writing, whether it's social media posts, books, or in person during appointments in the way that your practitioner talks with you. I don't know if any of you ever have noticed this before. In fact, I never really thought about it until I had to write the copy for my website, which was extremely difficult for me, which I still struggle with and change all the time. And then the second time it came to my attention was really with my patient, who has a much stronger sense of awareness for this particular issue. But essentially what we're talking about is whether a health practitioner is using the first person or the second person in their communication. So backing up just to talk about what the standard convention has been, what I think the narrative has, the understood narrative in the medical field has been usually from the second person. So using the word you to create a treatment plan, guidance, which has a very directive and dictatorial voice, where there is this sort of inherent structure of power where the doctor is here with their expertise, the patient is here with their problem without a lot of power. The doctor uses their position to disseminate information and tell the patient what to do. The patient is expected to receive it, and then they move on. The expectation from the patient's side is that the doctor has the power, because they have the expertise, because they have the knowledge and training, to disseminate this information, a little bit like a vending machine, where they can come with their problem, the doctor has the solution, and that's it. That's the expectation. But moving forward from that, and then opening this up to what it looks like for a practitioner to speak from the first person, now we're talking about a practitioner using words like we, or even the singular personal pronoun I. So when you're reading material or listening to your practitioner, number one, do you even notice this? Can you sense a tone, or even sense how you feel in response to whether your practitioner is using the first or second person? Has that ever even come across your line of awareness and had an impression on you? But if it hasn't, let's just talk about kind of what it might look like in case it does have an impression, but maybe you just haven't been aware of it or thought about it. So in the use of the second person, there's pros and cons. The pros being that the idea that there is this expert who has the solution or the information creates a sense of security and safety for somebody who doesn't know what the solution is. Knowing that there's somebody out there who has the power and has the ability to solve your problem can be very comforting for a lot of people. It is also really reassuring to know that there are people who are well trained and educated in this field that automatically makes them the expert, which is, of course, inherent to the job, of any person who's been trained for a specific position. But from an emotional perspective, it's sort of an automatic transfer of expectation that the patient knows the doctor is going to have their solution, and the doctor knows that the patient is going to receive it. It doesn't take a lot of thought, and it is pretty black and white. The downside, or the negative side, that can pop up for somebody that's experiencing that second person narrative is that it might reaffirm or reiterate a negative childhood message that was instilled when they were young. That message being that the right answer to something, or the truth of something, or what's best for me is going to come from outside of me. So it is that inherent belief that my well-being is in the hands of another person. So that when you move into an appointment and walk away from an appointment with somebody using the second person, there has not been any sort of consideration for how a treatment plan lands for the individual walking away with it. Therefore, it reaffirms the belief of self that my intuition and my sense of what's best for me is irrelevant, and my ability to thrive and be vital is in the hands of this other person. It's a way of outsourcing personal wellness. Now, I don't mean to be black and white in that, as in the doctor would never know, or that it's all one or one or the other. So obviously the doctor has been trained to do things that the patient hasn't, and clearly is a source of knowledge and information that is useful and necessary. But I mean to talk about the sort of all or nothing black and white exchange that often occurs in conventional appointments. So flipping it to the use of the first person, where we're using words like we or I, the power structure has changed. So now instead of it being hierarchical, it's equal. And it's more of a partnership where there's discussions and conversations around what feels best to the patient. It is the mutual exchange of expertise and knowledge from the doctor with the intuition of the patient that makes it a little bit more fluid and flexible, giving the patient, in some cases, a sense of more personal authority and autonomy and respect as an individual, as well as it creates a relationship with the doctor of trust where both are listening to one another. The downside to this is that some people interpret this as being unprofessional, and I would say some people, I think, consider this to show a side of the doctor that makes them feel insecure. So if I were to use I in discussing any topic, I would be showing a vulnerable side of me. If I use we, it's a little less vulnerable, but it's definitely much more like I'm including myself in the general population. And while some people might see that as relatable, other people might see that as not authoritative enough, and therefore would put into question their expertise or their confidence. And so for some people, while they see this as a positive way to relate and feel safe and create a trusting environment, for some people it creates this sense of insecurity or fear that their doctor does not have, that they're not good enough at their job. So those are the sort of two cases for the pros and cons of using I, we, or you in communicating to patients or clients. And so anyway, I just thought this was a really cool conversation and would love to know what more people think. If you guys have any particular thoughts or differences of opinion about anything, would love to hear that. Or if any of you feel this way, or if any of this is relatable. And if you look for a particular tone of voice from the medical practitioner that you are choosing. So again, I don't know how many of us are really conscious of this particular area when we're looking for a doctor or other practitioner, but now that this conversation has come up, would it influence your choice in who you follow, listen to, or feel that you want to build a relationship with? Let me know in the comments.